Mike. So my next question to you is how much is my procedure going to cost?
Yes, and this one is probably the trickiest one to answer because there are a ton of different things that are at play here.
Hmm.
One, do you have insurance that covers the procedure or do you not? So if
Okay.
if you don't have insurance that covers the procedure, then we do have a set list of prices. It's called our fee schedule that corresponds to each procedure so that we would know based on what procedures you needed to have done, how much that would cost. However, if you do have an insurance coverage that would pay for all or some portion of that procedure, we've actually negotiated different fee schedules with every different insurance company out there. So depending on the insurance company, they tell us what we're allowed to charge in total. And
Okay.
then based on your specific insurance plan, let's say, for example, a lot of plans cover 50% of crowns.
Hmm.
So we'll take into account that fee schedule that we have been dictated by your insurance company, and then basically they pay 50% and then you pay 50% if that's the percentage. And now, if it were that simple, that would be phenomenal. But we always have to throw in things like deductibles and
Okay.
annual maximum benefits that you're able to use. So that's why it's so important for us to get all of that information before your appointment. So we would communicate with your insurance company, find out if you do have a deductible, find out if it is a covered procedure or not, and if so, how much would be covered. How much of your maximum have you used throughout the year? These are all questions. We literally have a list of 20 questions up at the front
Hmm.
where we ask the insurance company every time. And I think that some of them have learned who we are, so they just kind of go down the list as we ask, and they're ready for the answers right away, which is good and helpful. But the point for
Hmm.
you is that it depends. And
Hmm.
sometimes when we tell patients, well, it depends, they look at that and think that we're just trying to pull one over, or we're just looking at the numbers aspect of it, where that's not the case. The reason why we want to wait until we know for absolute certainty is because, like I said previously, we pride ourselves on telling you guys if there's going to be a cost, we're going to tell you that up front. And then if there is going to be a cost, we want to know what it's going to be so that you're not surprised with a bill on the back end. Um,
Okay.
Mistakes can be made from time to time, and it does happen. I'll be honest, but for the most part, we are very accurate with the estimates that we provide. And so, long story short, I would just say that we'll let you know before we start the procedure. So, Dr. Monica and Edith, or Dr. Monica and Sierra, will talk with you about the treatment that they've identified during your visit, and
Hmm.
then somebody, either Katrina or myself or somebody else in the office, will talk to you about what the numbers of that next visit might look like. So we'll make sure that you'll know well in advance before we start anything.
Okay. Good
So,
answer. Yeah, there's so many variations and variables. So I know you guys up front try to do your best to like check all your marks and everything.
mm-hmm.
Just takes a little patience on your end, so that's awesome. But
It does,
we
and
definitely try to make sure we let you guys know
we're working. I want to let you guys know too. We're working on a video. I'm trying to find out the best way to show, because it's a lot of it's just a lot of numbers, and there's a lot of
prior. Hmm.
complexities, and every plan is different. But we're working on a video where we can actually show you kind of how these things work, so that if you don't understand it, it'd be maybe a good resource to check it out.
Hmm. And that'd be beneficial not only for your dental benefits, like if you have other insurance coverages. A lot of times they work similarly, even though some might be a little bit
Sure.
different, the overall terms and things like that.
No, that's a
So
good point too. All right,
I'll definitely
Edith.
be looking out for that video.
Okay. Good to know. All right. No pressure, right?
Right, you got
Excellent.
it.
Thank you, ma'am. My